Okay, thanks and welcome back to everyone. We're going to move on to our next panel, which is what is the future of academic meetings, virtual or in person, and are we out of date? And our moderator today is Ellie Maghami. She's the Norman and Sadie Lee Foundation Endowed Professor of Head and Neck Surgery and Head and Neck Cancer, the Chief and Professor and Chief of Division of Head and Neck Surgery in the Department of Surgery at the City of Hope Cancer Center. So thank you, Ellie, and welcome to the panel.
Thank you very much. I appreciate the invitation to participate. So yes, I'm Ellie Maghami, head and neck surgeon at City of Hope Cancer Center in Los Angeles. So welcome from Los Angeles. I'm going to be the moderator for the session this afternoon titled, What is the Future of Educational Activities, Virtual or In-Person and Out of Date? This was a program put forward by the American Head and Neck Society Education Division. I just want to take a moment to thank Melanie, Dan, and Cherry Ann for the invitation to participate in this fashion. I do miss everybody, and I look forward to a day and time where we can be face-to-face together again. You know, yesterday we heard outstanding talks regarding COVID and how it impacted every aspect of life and society globally. And really, the pandemic was first in a lifetime for most of us. There was significant initial uncertainty regarding the nature of the virus, its patterns of spread and virulence. And that uncertainty was really paralyzing at the very beginning, especially as we learned about the increased vulnerability of our otolaryngology colleagues overseas. So we had to hit a hard pause, and we did, and operations ceased and conferencing stopped, and we basically became walled off from one another in day-to-day interactions. To push through this, we had to gather our facts first, and then we had to come up with safety standards and strategies and new models of practice for patient care, education, and research on web platforms. So we became inventive by necessity, and we employed telecommunication technologies to stay on mission, and then in the meanwhile, be able to keep a sense of community. Yesterday, there were a number of outstanding panels that addressed how COVID changed patient care practices, especially in the oncology arena worldwide. And some of the changes like telemedicine are here to stay, and they're going to be further and further integrated into our day-to-day practices. And so today, with this session, we're going to touch upon experiences that we had in the year past in postgraduate training, conferencing, and research collaborations and virtual platforms. And then we're going to explore the lessons that we learned and how we can learn from those lessons and utilize those lessons in implementing strategies for academic meetings of the future. So I am joined by 4 outstanding panelists, and I'm excited to introduce them to the audience. Thank you so much for your time and for your commitment to the society, for being here to share your insight. So me being on the West Coast, I'm going to start on the West Coast first, and then I'm going to move eastward. So we're going to begin with Dr. Patrick Haw. Dr. Haw is Professor and Chief of Head and Neck Oncologic Surgery in the Department of Otolaryngology Head and Neck Surgery at the University of California, San Francisco. Dr. Catherine Hutcheson is Professor in the Department of Head and Neck Surgery and Associate Director of Research in the Section of Speech Pathology and Audiology at MD Anderson Cancer Center. Then we're going to move forward to Dr. Carl Snyderman, Professor of Otolaryngology and Neurological Surgery, and also co-director of the Center for Cranial-Based Surgery at the University of Pittsburgh Medical Center. And last but not least, and joining us over the phone from Egypt, Dr. Hisham Mehanna, to give us a more global perspective on the subject matter. Dr. Mehanna is Professor and Chair of the Department of Head and Neck Surgery at University of Birmingham, UK. He's also the Director of Institute for Global Innovation and the Institute of Head and Neck Studies and Education. So thank you, panelists, for being here. Thank you for participating in this session. And it's so nice to see all of your faces, even though it's remote and on virtual platform. So let's see. So the way this session is organized for the purpose of the time that we have together, the first 20 minutes is going to be dedicated to the panelists kind of sharing their perspectives as to what happened last year in their respective institutions. So they're going to take each 5 minutes to explain exactly what the local events were from the standpoint of conferencing, trainee education, and research collaborations locally at their institutions. Following that, we're going to open into a open forum panel discussion where we're going to do a little bit broader consideration of the subject matter and dive a little bit deeper into the details of the matter to try to get a better, more in-depth understanding. And lastly, I hope to have some time for audience questions rather. This I hope to be a very interactive session. So I am asking and hoping that the audience will step forward with questions that are relevant to the subject matter. Please do not be shy. Put the questions in the chat box and I will do my best to address the questions with our outstanding panelists. With that, we're going to move forward to the first section or segment of the session, and that is hearing from our local panelists. So again, starting West Coast and moving eastward, I was going to invite Dr. Ha, Pat, if you can kindly let us know what you've been up to last year at UCSF.
Great, thanks so much, Ellie, and to Drs. Nance and Deschler for organizing this awesome course. Of course, it's ironic that we're talking about education and we're here virtual. But I wanted to talk about an in-person experience that we had with our trainees. So, obviously a big part of our day-to-day life is training the residents and the medical students, fellows. And so what did we do for one of these really important courses that we traditionally had? How did we pivot? So I just wanted to take 5 minutes to talk about that. So I just have some disclosures. These are not relevant, but the educational funding absolutely is. And these are the companies that actually help support these efforts, really focus just on resident education. So thank you to these folks. So traditionally at UCSF, since I got here in 2015, we'd had a couple of joint head and neck dissection courses capitalizing on our great partners just down south at Stanford. And these were held at Stanford, and we invited some of the UCSF residents and faculty to participate. We thought more broadly starting in 2018. So for the past 3 years, we garnered more educational support and ran this with Stanford, UC Davis, and the Kaiser Oakland team as well. So we had faculty and residents from all 4 sites, and we decided to centralize this at UCSF. It was basically the largest dissection course space, and it was more centrally located for everyone to have access. So we typically had 35 to 40 residents. We would often have guest faculty fly in just for fun, and it was a great course. We had 2-day courses with 1 day typically focused on ablative and skull-based resections, and the 1 day of reconstruction. And we'd have 10 cadavers typically. So it was a big effort. And we'd really had a lot of fun doing this. And then of course the pandemic hit, and it literally happens in January. So it's just before that we had our course and the pandemic struck. So we really had to change what we were doing. Oh, are you seeing my slides or no?
Unfortunately not, and I'm trying to figure out how to.
Kate's giving me the thumbs up. Good. Okay, good. All right. So sorry about that. So actually, the previous photos weren't interesting. So okay, for the pandemic struck, and this is our dissection course room. You can see it's very long. There's actually a view of the Golden Gate Bridge coming out here, so it's really nice. But in January 2021, we basically had to pivot, and these were the rules that were imposed by our institution. So we could only have 13 individuals, and they basically could pull back a partition here, so we'd separate the room into 2 to sort of limit the exposure. We were not allowed to eat on site. There's no lecture halls available. The vendors were not allowed during any dissection. And of course, the typical health screening just to get into the building was in place. And so what we did was we, at this point, had to limit it just to the UCSF residents and fellows. And we had 2 faculty going in each room. And this was Dr. Heaton here, who helped run the course with me. And we had 4 residents per cadaver, so we only had 4 cadavers at this point. The participants had to be vaccinated. And what we ended up doing, which was kind of great, was we actually prepared all our lectures ahead of time. Normally we have a lecture session and go to SEC. We just did it all ahead of time. And we made it very video based. And so we have this GoPro that's floating around our division that we just stick on our heads, and we can video little segments of procedures. And so everyone prepared different videos of how to dissections and had them up on Box ahead of time so that the residents and the learners could view them and understand what we were doing. The vendors came in the day before. They were very happy to participate, even not in person, but they set up the day prior and got all the equipment set up. We basically wore PPE the entire time. In fact, we COVID testing all the cadavers as well, because at this point, one didn't necessarily know if they were positive either. We had lunch sort of off-site. We just distributed lunch boxes and people went off campus to eat. So just as a brief thing, this is our agenda. I'm not going to run through the whole thing, but essentially we did our ablation one day, skull base, and sort of starting some of the more reconstructive type of approaches. And then the second day was really focused mostly on reconstruction and things like nerve grafting. So it was a very packed day, but we could get through it all. And in fact, we did. So people stayed, until 4 or 5 each day dissecting, because it was just a lot of fun to be able to review a lot of this anatomy. And for the junior residents, great to have a first hands-on experience. So I'd say that the successes were that we had nearly all our residents were able to attend. A couple were out of town or on call. We had 11 faculty members participate. Like I said, the corporate support was outstanding, and they were very understanding and eager to support at this point. And so we broke even. We didn't have to, cover any costs in this case. We had in-kind support in terms of equipment and plates and screws and all this stuff. The lectures online were actually very well received. And even for residents now, going into the case with any of our surgeons now, they can look at these things so they're still on Box and they can understand how do they approach things. We were able to get through the entire agenda and really utilize the time, the cadavers, and the resources to the maximum. There's no COVID exposures. Everyone was fine. There's no outbreak, which we were somewhat worried about. And we had great feedback from the residents and faculty. And to put it in perspective, this is the first time everyone had gotten together, as a group. And so it was almost exciting just to see each other's faces again in a setting like this. And the fact that we were learning at the same time was outstanding. So I think the bottom line is that, we were flexible, meaning that if we had to cancel last minute, we had to. But we knew that if we really wanted to get this done, we felt that we were committed to the training of our residents and that this was important, that we were going to go ahead and do it. So we basically planned the whole time that we're going to do it. We sort of put in some changes that made it feasible. Like I said, the corporate support was outstanding. And so we really are very thankful to them for allowing us to continue to do this. We had our rules and, we just had a lot of fun. And so it was almost like a reunion of sorts. So I highly encourage, continuing on these types of efforts. And we're really looking forward to next year where we can hopefully, regroup with the Stanford, UC Davis, and Kaiser teams again. So thank you.
Thank you very much, Patrick. I appreciate that very much. I have some questions about maybe other formats of resident training that perhaps you're exploring or thinking about going forward. I will leave that to the panel discussion section. And I think we're going to move on to Dr. Hutcheson and see what happened at MD Anderson last year.
Well, thanks so much, Ellie, and really appreciate the opportunity to join you guys today. So I'm going to talk about our experience specifically in developing a webinar series. We historically have hosted a live continuing education sort of 2-day symposium focused on supportive care needs, really from the speech pathology perspective, about every 2 years. And we were due for one in 2020. And wanted to provide an educational forum, but clearly couldn't bring folks live on campus. And so went back and sort of revisited what might be an opportunity. And so developed what we're calling the MD Anderson Head and Neck Collaborative. And it's a webinar series. And just for some background, the series program is shown here. We put forward 7 90-minute webinars that run every 2 months. They're hosted live with a Q&A panel. And the idea is to have interdisciplinary faculty from multiple sites. And the framework is to really, focus in on very specific topics in rehab and supportive care needs. Things like complete esophageal stricture, trismus, and large puncture, a very focused conversation with faculty from at least 2 institutions to present protocols and the evidence base surrounding our management of these issues. And one of the real advantages we found in moving to the virtual platform was the ability to be a little bit less insular at a low cost, right? So historically, when we're hosting these continuing education events to maintain cost, we use a lot of our own faculty. You know, for that reason, it becomes a little bit of a singular sort of conversation about the way we manage things and within our organization. Whereas in this virtual environment, we save the cost of inviting you know, multidisciplinary faculty. And it's been, I think, a real increase to the quality of the program to see that diverse sort of conversation and dialogue between the panelists. So the primary target for this offering has been oncology specialized speech pathologists, and that's allowed us to sort of, from a logistical standpoint, manage it in a pretty confined and doable fashion. Just looking at the logistics here, were able to partner with industry support, who provided in-kind support, not financial support, to support all of the background, sort of the technical platform related needs. So this includes hosting the live webinars through their Zoom webinar platform, as well as providing live tech support, and then formatting for on-demand hosting of the recordings. Our industry support, which is AHNS Medical, has also provided the processing of registration and payment, and the CE administration through American Speech Hearing Association. And, you know, we found this to be a pretty invaluable arrangement to try to make it such that our team is taking on the programmatic side of this, but not really having to figure out the headache of all of the technical side that, frankly, is just not, you know, our expertise at all. We did grapple a bit with whether to host this free of charge, and ultimately landed on a pretty modest registration fee of $99 for the annual series, which is, you know, 7 90-minute webinars. And so, and that's something that I welcome some conversation around, which is, you know, how we sort of adapt the registration fee process that's historically been quite substantial to do live events in this virtual environment. We have used the Zoom webinar platform, which I've found to be extremely useful because of its functionality that's targeting this type of event specifically. And the primary utility that I find is the specific Q&A feature. So you can see an example from their website of the different functionality for question and answer, which is the interaction with the audience participation, versus the chat that can be reserved for either conversations between the faculty or specifically participants who are needing some technical support. And the Q&A is really nice for the moderator to be able to manage. You know, you can flag questions. If you're getting hundreds of them, you can flag those that you want to specifically address in a live panel, those types of things. And the faculty can be replying to them in text format during the live webinar offering. So a lot of nice functionality, really streamlined for this type of offering. I'd say from lessons for success that this is definitely a whole new world. It was a bit uncomfortable for us to sort of figure out how to structure this. It's been rewarding, and we've found great value and had a lot of really positive feedback on our evaluations, but everything's quite different in these virtual meetings, particularly with regard to moderating and timekeeping if you're having a mixed panel. So those sort of subtle, hints that you might be able to give to somebody on timekeeping are pretty difficult to do in that virtual environment. Moderating can feel a little bit stifled because the conversation is a little less fluid. And so I think that we're all sort of finding our way here. I hope that we'll be back in that live environment for these types of offerings, but I do think that this gives us an opportunity to have a broader reach and a more sort of multi-site, institutional perspective in our continuing education. I found that having industry sponsorship has been extremely key to making it administratively feasible. I don't think that we would have been able to try to organize this with the bandwidth we all have for our day job. And I also find that while I don't love Microsoft Teams for a lot of things, I love it for the organization of a very discrete sort of continuing ed offering like this, where you're working between organizations and different faculty for the document sharing in like a very streamlined place for communications like the chat. And one of the things we even do is we keep Teams open during our live webinars. And so the faculty and the organizing team are actually using that as our communication platform while Zoom's running on the parallel with the actual meeting. And the number one thing I would say is if you're doing it live, that it's all about the tech check and really making sure that that's sorted out beforehand. And we found that doing it about like 2 days before the live offering is good because everyone, for the most part, has their slides together. If they need to run a video, they can check it then. A week is too early. And so those are our lessons learned. It's been rewarding. Like everything in 2021, I went into it kicking and screaming and didn't really want to do it. And now I'm glad that we did. So.
Well, thank you very much, Kate. You can clearly see that, you know, a tech check is really, really important. And I'm learning my lessons on that as we speak right now. So congratulations for getting this done. It's fantastic. And I do have some follow-up questions for you for later on. Let's move on to Dr. Snyderman. Carl, if you can kindly share what you've been up to in Pittsburgh and maybe even beyond.
Well, thank you, Ellie. It's a pleasure to be part of this panel. Let's see if this all works. Can you see my slides okay?
Yes.
Great. So it's been an interesting year, to say the least. And so just going to give an overview of sort of the variety of things we have been doing, some of the challenges we encountered, and really with sort of focusing on what I do mostly on the skull-base arena. So what was life like before the pandemic? Well, we were doing lots of on-site dissection courses. We had 3 to 4 a year, and some of routinely these are fairly large courses with as many as 60 people from international sites. So this was a big change for us, and a lot of off-site travel, both domestic and international travel, doing live demonstration surgeries, especially internationally. And the usual collection of conferences domestically and internationally and at the hospital and so forth. And then we also have our own educational website, a free educational website for skull-base surgery that we've been posting content to regularly. So then the pandemic came along and there was an abrupt stop to everything. We still haven't gotten back to doing on-site courses. And I kept my sanity through most of the year by writing poems, a lot of limericks. But, you know, clinically, we got busy again, but the educational activities took a hit. One very positive thing has been the profusion of webinars. You know, people really getting together who wouldn't have otherwise. You know, international webinars where we can pop in for an hour lecture and right in the middle of our clinic schedule in between surgeries. And so I think that's been a big positive. And although I'd say we're all getting a little bit tired of that at this point. Our one solution we've taken to not having on-site courses is to organize some multi-institutional courses. And this is still a work in progress. And the idea here is that we have joint faculty, but each site is running their own lab. So having their own dissections but that requires separate agreements with the industry sponsors. So we tried to do a single agreement through our site, but the lawyers got involved and said, well, there are liability issues there. You know, how are people handling specimens at other sites and so forth. So we've gotten around that by having each site have their own agreement, but we can share educational content via Zoom or another vehicle. And then each site does their own prosections and dissections on their own. And then they're relying on their local industry support for bringing in equipment. And actually, this may be an advantage because a large course requires bringing in equipment from around the country. That can be a logistic problem for the companies and limits the size of your courses. So this actually may be a positive thing to organize courses like this. We did a live surgery demonstration, which went very well. We had over 1,000 people signed up internationally. But then we ran into some tech issues. As you can see here, the platforms vary in what they can accommodate, and that the Teams, Microsoft Teams, only allows up to 250 participants, but it is interactive with live discussion. Teams Live has no limit on the number of people, but you can't really have live discussion. It's limited to the chat function as we're using today. And then Zoom depends on what your institutional license is. At Pitt, we are limited to 500 people. So for our live surgery with over 1,000 people, we had to go with Teams Live. There was a lot of sort of technical problem solving at the last minute. You know, we had to sort of go, have an IT person sitting in a closet with all the servers and running connection between a laptop to make sure that we could get the feed from the OR. And then we had the additional difficulty of having simultaneous surgeries going. So we wanted to be able to switch back and forth between rooms. So there are a lot of failure points here, and you really need to check these things more than a few hours beforehand, really several days beforehand, and keep checking them over and over again. Invariably, new problems come up. One thing we've learned is your IT person is worth their weight in gold. And there really is a learning curve on both sides, a lot of problem solving. And I think we have a hotline to the IT people now where we basically can call them up almost any time. And you really need lots of contingency plans, backups for your backups. Lots of things can go wrong, especially if you're dealing with multiple cases. One strategy we thought about was having a videotaped sort of live case with discussion on standby in case the feed went down. We could always just plug in a tape and it would look like it's a live procedure going on. But you want to keep things moving. You know, presenting in this style can get pretty static and without the same interaction. And so jumping back and forth between rooms, having surgeons as well as discussants, so you can have a dialogue going between different faculty at the same time, and sort of fielding questions through the chat functions. And then the consideration of multiple time zones, especially if you're dealing with an international audience. With our website, we try to develop more content. And one thing we did was bring in more outside contributors, having people submit cases for discussion, having journal clubs, all kinds of events, and providing links to outside events, especially making people aware of webinars that were going on and that we were participating in. So really trying to create or increase the opportunities for people to stay engaged. And then we've also reached out to patients to maintain communication with them and to do patient education. And through our Eye and Ear Foundation, we've set up a series of webinars that are held monthly. And these really cover the whole range of ENT. And here's one that we did on endoscopic skull-based surgery. But that was a lot of fun. And I think the patients really appreciate that opportunity to see what's going on, to know where their research dollars are how they're being used. And then we also have a skull-based newsletter that we publish 3 or 4 times a year, providing patient stories or sort of academic reviews, research activities, all kinds of things. And just a few comments about technology. We've really had to build up our conference infrastructure this year, and I would say that's an unfinished task. Many of our rooms are really not well suited for these types of activities. A big learning curve for the surgeons as well as the IT support staff. And we've really had to learn how to deal with different presentation formats. Each one is different, and there's really a lot to know. Certainly one thing that we've done in the past and would like to do more of in the future is live surgical telementoring. And I think this year has really pushed us to develop the technologies to enhance those services. And so that's it. Thank you.
Thank you very much, Carl. You've done a lot. Congratulations for all of that. And you have addressed some of the questions I'd prepared for the panel discussion. So a little bit more on that later. I wanted to now transition over to Dr. Mehanna from Egypt, joining us right now for a more global perspective as to what's been possible over there in his parts of the world. So Hisham, welcome. I look forward to hearing you.
Ellie, thank you. I hope you can hear me okay.
We can.
Great. Look, I've got a thank you and an apology. The thank you is thank you to you and the organizers for the invitation. The apology is that I'm doing this from Egypt, where I'm visiting my mother after a year of, no visits and COVID. And we actually decided to catch a couple of days on the beach resort. And I suddenly realized that I hadn't packed anything to appear in front of you. So I'm apologizing for the slightly informal dress, but it could have been a lot worse. This was the other option that I had. But, so
it's very Zoom appropriate. You look great.
Thank you. Look, I'm going to concentrate briefly on the lessons learned from our BACO International meeting. The BACO International meeting as a background is a face-to-face meeting that happens every 2 years. It's the premier ENT and head and neck conference in the UK, and usually attracts about 1,000 to 1,100 delegates. And I was the academic conference chair for the conference in July 2020, or the one that was supposed to happen in July 2020. Obviously, in March, in the UK, COVID hit in March time, and we had to start looking at alternative options. And I have to say, we, as a group and as organizers, wavered a bit. Initially, the ENT UK, which is the professional body that is responsible for the conference, said, "Oh no, we're going to go ahead face to face," and then we postponed it to January 2021 face to face, and then we changed it to virtual. In January, as a virtual event in January 2021. So I'm going to talk a little bit about what we did well, and then a little bit about what we didn't do as well. Generally speaking, I think as a general point, we started very early with BACO 2020, and we prepared well. I think it's 4 years in the making, and that was a new thing for BACO. Usually it's 1 or 2 years. And I think that served us well because it got the program done early. And so when we had to switch, we didn't have to worry about organizing the program and then switching at the same time. We had a program that was ready, and we could amend it towards the virtual. We also, from the general point of view, we worked very well together and supported each other very well when COVID hit, and we had to change things at short notice. So there was a real team spirit, and I think that saw us through a lot. Specifically, in terms of the virtual aspect of things, I took the decision early on to simplify. We had 11 tracks in the program when it was face-to-face. They were all running at the same time. There was, I think there were 180 sessions with over 300 talks. And that's not including, the abstracts, etc. So we decided that we would only do virtual talks. We would only do them pre-recorded. We had very few panels, and all those we had few panels, but all those were pre-recorded. And we didn't have any live panels or questions and answers. And I think that was really important because we had limited time and resource to convert from face-to-face to virtual. We had essentially about 3 to 4 months lead time. Given time, of course, we would have wanted a lot more panels and a lot more live interaction, and I'll talk about that shortly. We also used a provider for virtual webinars that had a strong track record, and I think that really helped us in that conversion pretty quickly. They had a platform that was ready, they had formats that were ready, and therefore that was very beneficial. We gave clear instructions on the format of the talks, the instructions on how to do the talks and record them. Again, we heard a lot about good IT support, and we actually grouped people into IT support sessions so they could drop in. We could talk a group through the participating and how to join and so on and so forth. And I think that helped a lot because we didn't have very much time. I think one of the benefits of the virtual format was that we reached a lot more people who had not or could not attend previously. So we reached about 1,400 people, which is up, that's almost 30% up from previous conferences, and 45% of those people had not attended before. 20% of those people were international delegates as well, when normally we have about 10%. We found that the industry and exhibitors, we had concerns about this initially, that they wouldn't engage, they wouldn't participate, and it's important for running BACO. But they actually engaged. The feedback from them was very positive after the event, and they found the virtual format useful because of the multiple times that they could contact people and reach people. We also gave people 6 months. So you bought a pass to attend the meeting, but you also got access to all the content for 6 months afterwards. And in fact, people are still going through content currently. And I think that was people, the feedback that we got was that people found that very useful. They could attend simultaneous talks now. They could look at simultaneous talks. They could go through a very big program in their own time, and that they found that helpful. And by going virtual, we also found that it costs much less than being face-to-face. So we were able to reduce the fee by 60%, which I think also helped the access and helped diversify. So I guess those were the things I think that we did well or went well, but what were the things that didn't go well? Well, I think, we didn't take the decision to postpone early enough. And I think, in retrospect, we should have just made the decision. There was too much uncertainty in the system. There was no way it was going to happen face-to-face. And so we should have taken that decision early. Our virtual poster presentations, it wasn't a great format. The posters were too small. And I think next time, given time, we would do presentations of the posters, actually, in the same way that we do poster trains. People could record a 60-second presentation of their poster, and that could be easily appended to the actual poster itself online. I think the lack of interactivity we thought was going to be a real problem. It was, and that was part of the the feedback, that people would have liked more interaction, but wasn't as big an issue as we thought it was going to be. I think about 20% of people said, they felt that there was less interaction than they would have liked to. But what was really, quite clear was that there was a lack of networking opportunities, and that's what people missed most about the virtual format. And that was the biggest feedback that we got, or the most common feedback, is that there were no networking opportunities, and they really missed that. And given time, we would plan that into the format. I'm not sure how we would plan that in, but I think we would make a real effort to plan networking into the format that we have. That's it for me.
Thank you very much. You covered a lot of the issues that I wanted to bring to the panel discussion and the open forum, so I appreciate that. We have to catch up with time lost a little bit, so I'm just going to whiz through a few slides that I had prepared. So we're going to pick up where I left off. I think you all should be congratulated on everything that you've been able to achieve over the last year. And obviously these are you know, sort of unknown territories. There's rocks and potholes along the way, and we've had to learn navigating these obstacles, and these lessons learned are going to serve us well as we get better poised for the future meetings, hopefully once COVID situation is under better control. So I was wondering if you guys are able to see my slides right now. Is anybody able to see? No. Okay. So what I'm going to do, if possible, is share again. And are you able to see my slide? Perfect. Awesome. Thank you very much. So so let's go into panel discussion at this time. So the first thing I wanted to pose to the panel is, how do you set up a virtual meeting? And I think a lot of the pertinent issues were already discussed by Carl and Kate and Hisham too, on a more global international scale. From the standpoint of this person who does not have much experience, what is the very beginning core of the conception of putting a meeting together? What's the pre-planning phase? What's the planning phase? Who do you get involved? As you clearly stated, IT is fundamental to a successful program, and being able to do the necessary background work and the technical checks to have a smooth program is extremely important. The other issue that the panel brought up is, you're able to provide, programming and educational content for the patients at a lower cost, which I think is fantastic. But perhaps on the flip side of that, since sometimes these conferences are no fee or low fee, people register, but they don't necessarily participate in the forum. And so if the institution pays for upgraded Zoom platform to be able to facilitate a larger group of people, and then only half of that shows up to the podium, that is a potential downside of that a lower fee or no fee registration. A lot of the issues on this slide as to how to organize, how to put a group together, how to put a committee of people together to put a plan in place, to get the right speakers. A lot of that was discussed already. I'm just going to ask the panel if they want to add any content or anything that may have been missed in the discussion that was had so far that is pertinent to the actual anatomy of a virtual meeting. Pardon me.
Ellie, I think I would add that I think that the very fundamental step is sort of deciding, what your format is that you're trying to achieve, and then separating out your teams into like a technical team who's helping you to try to accomplish that, and your program team that you would have always had when organizing any sort of a live conference. Because I think that the scope of expertise brought to the table for those two teams is very different. And I think where it can get really overwhelming is when the team who kind of understands the program side that they're trying to accomplish is somehow also trying to juggle the technical decisions. So that would be my number one sort of lesson learned, is leave the tech to somebody else.
I would add that really understand your audience. That really determines everything. Do you need interaction, live interaction? Do you want a more informal group? Is it international? Are there different time zones? So that's going to determine the technology needs and the format, because not everything works well for everyone. And I also have backups for your backups. So if someone misses their connection, have a canned talk ready to go. Really be prepared to wing it on your own.
Thank you very much, Carl. Just to follow up on that, you and Hisham both put international programs together. Obviously, you draw audience from a wide time zone range. And as you put these programs together, how do you decide what programming is going to be live based on the registrants that you have and where they come from around the world? And how do you decide what the duration of the sessions should be? Over how many days should the sessions run? What is the frequency of the programming? Is it going to be daily? Is it going to be once a week? How do you decide these issues?
Hisham, do you want to comment?
Or, yeah.
Sure, happy to. Thanks, Carl. I mean, one really easy way around that, Ellie, I found was the idea of making the program available for many days or months afterwards. So it's recorded, and then you're buying or getting a pass for not just the 3 days of the conference, which is what traditionally we think of a conference is, but you're buying it for 6 months so that you've got access to that. And that gets over many of the problems of timing and etc. And even if somebody in Singapore couldn't make the live session to see the live session, they'd be able to view it as a recording as well. So that's how we got around.
Thank you for that. So some of the benefits of education on the virtual setting, you guys all alluded to already. We talked about broader access, wide global participation, ease of attendance, in a busy healthcare schedule, the ability to get in and get out quickly to grab the content that you want. This is especially important in early career individuals and maybe people early on in their careers who have other obligations to be able to get in and get on and grab some content. And if there's on-demand content, obviously you could see how that would be valuable. So those are all some of the benefits associated with a virtual meeting, but there are others. And Patrick, I thought I'd kind of call on you right now. You've been quiet since the beginning. I'm sorry about that. So what are the other potential upsides to the virtual setting, whether it's conferences or resident training?
Sure. So, we planned a CME as well during this time that we had much of the same issues that everyone else did in terms of, deciding when to go virtual and having to think about that. One thing that was kind of cool for our particular CME was that we were actually able to invite Dr. Fagan, Johannes Fagan, to be one of our speakers, who normally, as people were saying, you can invite international people and people from many different time zones. And we actually just gave complimentary passes to the entire African Head and Neck Society because we felt that, this was very focused learning that was good updates for all of them, for anyone. And so I do think that the ability to pull in people who maybe either couldn't ever attend or, the registration, like Kate was saying, you have this decision of, is it free? Is it $99 or whatever? So you need to cover your costs, but then every additional person, it's like they cost more. So if you felt that this content was valuable, would be useful to a certain group of trainees, underrepresented countries or areas, or people who you just feel like, that would benefit from this, you can do that. And then, like Hisham said, you can also leave it on for quite some time afterwards, so people can continue to view the content. So, and I think, like Carl was saying, you have to think about what the purpose is. Who are you trying to reach? What is the benefit they're trying to gain from this? And you start from that, and then you can plan your conference around that.
Thank you for that. One more comment over here, and that's perhaps because I'm in California and, environmental issues are kind of foremost in my mind. The carbon footprint of an in-person meeting is significant. And I was reading, articles on the subject leading up to this conference, and I and I couldn't help but notice that, you know, having a virtual meeting has only 2% of the carbon footprint of an in-person meeting with all the air travel and everything. And for most of you, you guys probably travel globally or travel numerous times, multiple times every year. So it really does add up. And perhaps that's another added advantage of offering some educational opportunities in the virtual setting that is earth conscious and earth friendly. So I just wanted to make a pitch for that. I think in the interest of time, because we're running short, I wanted to then spend a few moments, you know, talking about potential downsides of a virtual meeting. And maybe Kate, you can start the discussion here.
I actually think that the primary downside is that you don't have the dedicated time to engage as a participant or the faculty. So most of us don't block our day to do it. We just block the hour or so and we're running late from clinic or have 3 meetings after. And the one of the things that I think all of us value about attending live meetings is not just the camaraderie and what we learn, but it's also the pause that it gives us to kind of like think and connect to that environment. And I think that that's a real challenge. I know personally that I tried a strategy in March for the Dysphagia Research Society meeting where I actually took the days off and attended the actual meeting live, knowing that, you know, these on-demand offerings are great, but when are we going to fit that in the months coming ahead? And I found that to be a really far more engaging and rewarding, you know, experience for a virtual conference than trying to fit in a session between everything else during the day. So that to me is the primary downside.
I appreciate that very much, and I agree with you. So there was a comment earlier from Dr. Christine Gurin regarding what I might call Zoom gloom, where now that it's so easy to connect with anybody via Zoom, anybody can call a Zoom meeting anytime, any day, even on weekends. And how do we set a limit on that? And what should we do about the overexposure, the overtoxicity, the overburden of Zoom accessibility? Anybody wants to take that one?
Well, I think it's more of a supply issue than a demand issue. You know, there's a limitless international market for good educational content. So the question is, it's sort of demoralizing sometimes to get on a educational session and you see a handful of participants, even though it may be recorded for future viewing, you don't get the same positive feedback of presenting to an audience. And so I think there's a real risk of burnout, you know, doing things this way. So I find I'm less likely to attend a meeting now that it's readily available. It's something about not having that time carved out for you. And I'm not going to wander into a room and listen to a session that I wouldn't listen to otherwise. I'm just not good. I don't have the time in my schedule right now to do that. So that's a big disadvantage.
I appreciate that. I was hoping to be able to show this video to the audience. And have you guys seen this or not?
Yes.
Yes, you have. So I don't know if it's going to play. And I put it up. I wasn't sure if this falls in the pros or cons bucket because every time I see it, it cracks me up. But it does.
Can you hear me, Judge? I did not know that Zoom could turn me into a cat, and I did not know that a cat Zoom could turn me into an internet celebrity, but it all happened in just a matter of hours.
So this was a Texas lawyer who had a faulty cat filter on
Mr.
during
Ponton, I believe you have a filter
deposition in
turned
Texas.
on in the video settings. You might want to take a look.
Can you hear me, Judge?
I can hear you. I think it's a filter.
It is, and I don't know how to remove it. I've got my assistant here. She's trying to, but I'm prepared to go forward with it. I'm here live. I'm not a cat.
So I'm sorry, we're running short on time, so I'm going to try to wrap this thing up best I could, but that's basically a Zoom doom. But it does remind us that we're at the mercy of IT gods, and we need to know the digital platforms, and we have to prepare ahead of time. And like the gentleman said, once the toothpaste is out of the tube, you can't put it back in, so you can become an internet sensation overnight. So How to make the meetings more effective. I think we addressed a lot of these issues already. The one thing that I wanted to just emphasize is, where does Twitter fit in all of this? Tweets and retweets is really a powerful tool to get the word around in these conferences. This was a cardiology conference where a doctor was talking about an aortic valve device and posted a tweet. And then there were 119 responses posted to his tweet. And then there were a dozen or so people who retweeted his tweet and then responders to the retweets. So you could see how this can become a very powerful source on publicity and raising awareness and disseminating information about a Congress or meeting. And so I just wanted to put that up. I don't know who amongst the four of you tweets or retweets, but I'm not a big Twitter person. So okay, so just putting it out there that there is an opportunity here for us going forward. And lastly, to close the session, hopefully in the next couple of minutes, just your prediction overall. What is the meeting of the future going to be like? And what is the new normal going to be? And how are we going to integrate the best of our virtual experiences into what we all love, which is the very palpable organic humanity in our day-to-day interactions when we come together? So what do you think the future holds for us in terms of these types of academic endeavors? So if you can each please just give some thoughts on this issue, then we can wrap up the session.
We'll start from the West Coast. I think that it's going to be a blend, basically, because I think that we appreciate all of the great things in terms of outreach and access that a virtual meeting might involve, but we miss the interpersonal interaction. So I think probably a blended model where the people who can come together will, and then for people who cannot, then they can still enjoy at least the educational content and learning.
Any other thoughts?
I'll go to Texas then, if we're going geographically here. I think that I also hope that it will sort of land in the blend. And I actually would be so bold as to say that I hope that live conferences will be disproportionately represented by virtual, and particularly for large sort of Congress style meetings. I think that the virtual environments, in my humble opinion, best suited for smaller, shorter, like webinar type things, and that the type of engagement we're trying to get at a true conference is ideal live.
Thank you, Carl.
I would agree. I think we need to make better use of conferencing tools such as live surveys. I haven't learned how to do all those yet, but they are embedded in some of these platforms. And that's a great way to bring your audience into the discussion and allow us to do something that we don't do very well at in-person meetings. And with the new technologies, HoloLens, virtual reality, you could see yourself in a conference room and actually be walking around, talking to people, having private conversations. So that technology is not too far away. And I would love to see a meeting where everybody has a cat filter.
Hisham, any thoughts?
Blended, I think. That sounds good.
Very good. Well, thank you very much. It looks to me from what I've looked at that a lot of the audience that was surveyed out there does in fact welcome, and they do like the flexibility, affordability, accessibility of virtual content. So I think that's the direction of the future, and we are going to have some hybrid meetings going forward. A final question that came from the audience was, if and when we do have in-person meetings again, is everybody going to be asked to be vaccinated for COVID before they enter the meeting hall? Any comments on that? Nobody knows.
No.
Maybe, maybe not. It seems like people are being asked to do vaccination before starting school again. And so I was wondering if that's going to become an obligatory part of joining live conferences in person. So I thought to put that out there.
I'm not against it, but I think people will just have to be safe, like we have been in a mixed public venue already.
Very good. Well, these are my closing remarks. I think we're just a couple minutes over the allotted time. I wanted to, again, thank the organizers for bringing all of us together and thank all of you panelists for giving the time and insights. And sorry for my earlier technical issues at the beginning. So, that was, Zoom doom for me, learning lessons for me going forward. I appreciate the opportunity to be here and have a good rest of your meeting.
Thank you.
Great,
Thank you.
thanks a lot.
Thank you.
All right,
Thank
bye.
you.
Thank you, Ellie, and thank you for the rest of the panelists. I think this is an important topic that we're kind of learning in the process right now, actually learning and doing and talking at the same time. So thank you so much. And we'll have a break that ends at 3:15, and I'm going to tweet about this meeting during the break. So see you at 3:15.
Thank you very much. Bye-bye.
Bye-bye.
Bye, everybody.